Hey everyone, this is Sharon from Self Care for Black Men. Going live today talking about mental wellness. And we have William Batts as a guest and just waiting for him to pop on. And I'm sure that everyone had a lovely day. There is William. Oh, I think I did him wrong. Oh, yeah, I unhad him. Okay, let's see. Trying to bring you on, William. Okay, there we go. Did you get my request, William? Are you able to hear me? Okay. Okay, let's try this again. There you go.
Hi there, how are you?
I'm good. Well, I appreciate you joining me.
Absolutely.
Well, good. And I realized too that Tuesday is a busy night
Indeed.
as well. I almost forgot about that, which I've done it in the past on Tuesdays. All right, well, I'm going to send this out to a few people. But if not, they can always catch it on the replay, and then I also post it on YouTube as well.
Okay.
Well, again, everyone, this is Sharon from Self Care for Black Men, and today's topic is mental wellness in the Black community, and William Batts is joining us. And we're going to start off with sitting in silence, because one thing that I've come to realize in my work is that a lot of times we kind of just jump into things, and sometimes just taking a moment, even when it comes to meetings or talking, just sitting in silence, just to kind of allow us to kind of release with whatever we came in with and allow us to really focus. And so if anyone is driving, do not close your eyes and just listen to the words that I'm saying. And everyone else, just sit in a comfortable position, whatever that is for you, and that can be in a chair with your feet flat on the floor, or on the floor with your legs straight or your legs crisscross, or you can sit on a bed, whatever is comfortable for you. Ground your sit bones into the chair or into Mother Earth. Align your back, relax your shoulders away from your ears, and gaze your eyes down towards Mother Earth. You can close your eyes if you like, or you can just leave them gaze. Center your heart and place your hands on your lap with your palms facing the sky to receive the messages, to receive the communication that we're going to have today. And let's take 3 deep cleansing breaths. Just slowly inhale and exhale out your mouth. Let's do that again. Slowly inhale and exhale out your mouth. One last time. Slowly inhale and exhale out your mouth. Now center your heart with the rhythm of your breath and just notice your breath. And just observe any thoughts come into your mind. And if your mind is racing, just observe that too. Release previous conversations and allow space to this discussion that we will have. And slowly inhale through your nose and slowly exhale through your nose. Bring your attention back to the surface. Gently open your eyes. Well, thank you for joining me for that. Well, again, thanks a lot, William, for agreeing to have this discussion with me. I wanted to talk about mental wellness in the Black community, pretty much what you see as a therapist. But before we begin, tell everyone a little bit about yourself.
Well, my name is William Batts. I'm a native of Baltimore, Maryland, and I work with 2 mental health agencies here in the area. I do a lot of individual, family, group therapy, and I'm kind of in the trenches, if you will, with folks. And I've been impacted by mental health within my family unit. It's part of what I do in terms of work. So it's definitely it's around us all. It impacts us all.
Yeah, it sure is. And I myself, I've been working in the mental health field for quite a while myself. And so previous years, inpatient, outpatient, child and adolescents, with adults, and working in specialized program. I worked for an insurance company. I worked in an emergency room. and now I'm working for a call center. So I've seen a little bit of everything within the mental health community. And one thing that I have noticed is that, when it comes to blacks and mental health, is that a lot of blacks enter, the mental health system in many ways. And even though I say mental health system, it can be the system in and of itself, or it can be in a way of therapy as well. And when I said that, was referring more so to like community mental health centers and agencies and things like that. And so there's different ways in which, people enter that. With your experience, in what ways have people, I guess you say, let's back up a minute. It's kind of like, what have you seen, what people deal with the most when it comes to mental health?
Well, it's a lot of factors. There are a lot of factors that impact people's mental health. A lot of it has to do with how we're socialized. Just from the perspective of, when you look at it from a man's perspective, and I'll address this from a man's perspective. And obviously, a lot of the things cross. I mean, they're not, irrespective of gender, we're impacted by so much. But for example, with men, from a very, very, very young age, we're taught to be brutes. We're taught to be tough. We're taught to be a certain way. But being expressive, that's not one of the ways we're taught to be. Sharing how you feel, that's not how you're taught to be. And I think this is across all cultures and all races. I think it impacts people across, all cultures and all races. But again, I can only speak from my reference.
Yeah.
And, the other thing is that boys are so adamant about not wanting to appear weak. I'll give you an example. Yesterday, I was seeing a family, a mother, she's a single mom of multiple boys. And the boys were misbehaving. They weren't doing what they were supposed to do. They were, just being disobedient, and in many ways just being kids, because kids need redirection. They need some level of interaction, if you will. So they were out front, and mom had them do calisthenics as part of their, let's get this together. You all are arguing a little bit too much. You all are kind of pushing things a little too far. She had them to do calisthenics.
Yeah.
Some of the calisthenics were push-ups. They had to run down to a few mailboxes down and come up. They had to do squats. They had to do different various things to kind of make the situation right, because mom had enough. Well, mom brought back up that one of her sons, he wasn't cooperating. And so I asked the son, why he wasn't cooperating. And he said, but he didn't want to do a squat. So a squat, for those that may not be familiar, is literally a squat. You're on two legs and you squat down. You can do it with weight. You can do it without weight. So mom said that the boys had to do X number of squats in order to make good on their behavior, if you will. Well, one of the boys said, when I asked him, I said, well, you're not cooperating with your mom. What's going on? You didn't do the calisthenics like your mom said that, she wanted done. And he said, she's trying to make me gay. I'm not gay. He said, boys don't do squats. And I asked him, I mean, we're talking about cognitive distortions here. We're talking about how we get in the spot we're in. I played sports all of my life, and literally high school, I had never heard of boys don't do squats. He equated doing a squat with being gay.
Wow.
I just couldn't even fathom it for a moment. So I could see he was getting agitated. The conversation between him and mom was kind of taking a certain turn. So I didn't fully get a chance to explore it the way that I wanted to. But when I get a chance to meet with him again one-on-one, I will.
Yeah.
But just little things like that,
Yeah.
we tell ourselves from childhood. He thought that if he did a squat, he was less than. And the term he used was gay. He didn't want to be
Yeah.
gay. He's not gay. His mother's trying to make him do something gay. And I was just like, wow, that's significant. I mean, I hadn't even thought of it that way.
Yeah.
And
Yeah.
then, sometime when we talk about some of the barriers to mental wellness for people in the African American community, one of the things that's big in our community is mistrust. We talk about mistrust of police, mistrust of service providers, whether it be mental health providers or whomever it might be. Mistrust is a significant barrier within the African American community.
Oh, yeah.
Absolutely. And then when you talk about accessibility, not always are things as accessible as one might think. And then the other piece of it is that, and when I say accessibility, one of the components to that are culturally competent practitioners. So I think it's safe to say that if someone is operating in their gifts and if they are effective in their craft, they should be able to service any population. But we must remember that the consumer always has a right to say, this is who I would like to go to. This is who I want to provide services to me. And oftentimes it's just human nature that you're going to feel most comfortable with someone who looks like you. So a lot of times, especially, I mean, there are a ton of women in mental health. There are a ton of African American women in mental health, but there are not as many, obviously, men, African American men. So that becomes a gulf there. That becomes a gulf in terms of not having enough men.
Yeah, this is true. Yeah, and you touched on a lot of good things too, because you talked about trust, and and just with our history with mental health in the Black community, there's a lot of, I guess you'd say, mistrust when it comes to that, because it again depends on where you are. Because I know in certain places where I've worked, if you are, let's say, Black, and with some of these service providers, like if you are associated with DSS, it's like, what does that look like if you're going to, if someone is not Black? And even like in mental health, and I know even when I've been in school, and even individuals who I've worked with, we all have blind spots, and sometimes even though the person may think that they're being helpful, but they're not truly understanding, like some of the barriers and roadblocks that people may be going through. I can remember years ago, this was ages ago. I can't remember what kind of training it was, but I know it was a mixture of clinicians, and with whatever it was like there was this guy. Somebody was telling a story where this guy, where he was on probation, like for not paying child support, but he could not work like in another county, and if he did, then he would be in violation of that. And then, but it was the best job that he could find. You know what I'm saying? Because in his county, he couldn't find a job. And then, I think he ended up going to the other county, and, some kind of way he violated, not some kind of way, but he violated his probation. But I just always remember, I mean, and it was a white lady. She just felt like, oh, well, he just should have not, it's kind of like should have, could have, and all of that. It's like, it is not that easy, and she's probably going back and I can't remember, all the details, but I'm just using this as an example. But let's just say if he was selling drugs, I mean, just because someone's selling drugs, it doesn't, yeah, it's not that it's good, but for that person, sometimes people do it as a livelihood to put food on their table. You know what I'm saying? And that's the reality that some people don't realize, when it comes to that. I mean, let's be honest here. Blacks are not bringing drugs in the United States. You know what I'm saying?
Sure.
So,
Sure.
but in saying that, that lady, and I'm like, is she working? I sure hope that she wasn't working with a whole lot of blacks, because when you have people who have authority, because somebody can say something as if it's like saying, oh, they're not being cooperative, to misinterpret that. You know what I'm saying? All because they're not understanding where someone is coming from. And a lot of times that's where that trust and mistrust kind of comes into play, with our history within the United States, our history, within mental health as well. So that is, a really good point. And then you also mentioned about accessibility. And accessibility comes in, gosh, so many different ways. It could come in transportation. It can come in and not being able to afford to be able to pay. And then, some other barriers as well.
Right. And when you spoke about the cultural competence piece, oftentimes a lot of the people in charge, I've seen this. They don't have a clue, from judges to therapists to.
Yeah.
I remember being in traffic court one time, and the judge asked the lady. He said, "Why didn't you pay? Well, why didn't you pay the ticket?" I think if I recall, it was a ticket that was under $100. And she said, "Well, I have the money today. I can pay it today. But I didn't pay the ticket because it was a choice between providing for my children. I'm a single mother, providing for my children, or paying the ticket." You know what the judge said to the lady? You should have figured out a way. You should have paid the ticket.
Wow.
Instead of just really, in my opinion, when the lady said, "I have the money today, I'm prepared to pay the ticket today," the conversation probably should have been over at that point. That wasn't enough. That wasn't enough. Yeah. I think had it been someone who was culturally competent, who maybe could have related to the fact that things were short. She didn't have it. She's here today. She's prepared to make the payment today. Let me just let peace be still. But sometimes that's not the case.
Yeah, so true. So true. And so when it comes to individuals seeking help, I know before we got on, we talked a little bit about, like, sometimes some people in general, but especially men, but it can be women too, but in general, may not even recognize or know that they are in need of, that they have something going on. I'll put it like that they have something going on. Because I know that I spoke with a couple of people, and can't think of his name right now, Reggie Howard. I interviewed him, and he's open, and he was telling me by him listening to like a podcast, then he realized himself that he was going through something, because otherwise it was just, he's going through life, not really realizing that there was something more to what was going on with him.
Mm-hmm.
And so what are some of the things that you see or you notice where people either have difficulty recognizing that, or how can they recognize it, and knowing that, I need to talk to somebody?
Yeah, that's a great question, and I think this is across a lot of different cultures and across a lot of different cultures and races, but we're speaking right now about our community. And I know in our community, the African American community, you have these sayings and these things that people live by, that there's a little truth in there and there's some not truth in there. So
Yeah.
for example, what goes on in this house stays in this house.
Yeah.
Now, I think the concept that was trying to be portrayed there was we should be loyal to our families and we shouldn't just in an irresponsible way share information. But it somehow seems to imprison people, you know, because there's these secrets that go on in families, and they just permeate. So, you know, what goes on in this house stays in this house. Obviously, within the African American community, faith-based institutions are a part of our community. And, you know, sometimes certain churches have not caught up 2 times, you know, that yes, prayer is powerful. Absolutely. You know, yes, studying your word, fellowshipping with people are all important. But it is not indictment. It is not an indictment against your faith if, in fact, you seek mental health support. Because one of the things that have been said, you know, well, do you really need all of that? Do you really need, you know, you just got to pray a little harder. Do you really need all of that? And I would say, you know, that has helped to keep some people bound. You know, it has helped to keep some people bound.
Yeah, it really have. I know I went to a training here in Charlotte once, and one of the breakout workshops, they were talking about that, you know, the church and mental illness, and pretty much how, I guess you could say, shame and just not helpful at all. You know, it's almost like either you don't believe in God enough, or, you know, like you said again, just pray about it. And it's, you know, it's more about that. It's more, you know, about just praying. Is what people are suffering. And
not to interrupt you, but I want to make this point, right? Because you said it was about church and mental illness. That probably was perhaps mistake number one. It probably should have been about faith and mental health. Because people equate mental illness with the guy who's walking around downtown talking to himself. He's got on 100 pounds of clothes in 98-degree weather. People think that's what they equate that with mental illness. They equate that with mental health. It's just interchangeable in their mind. When the reality of it is that that's the extreme end of mental health. Just like when we talk about our somatic health, a person who is going to the doctor because they have a diagnosis of cancer or some other significant somatic health condition, that's the extreme end of the spectrum. But not everyone going to the doctor is going to the doctor for such a significant reason. And so when we talk about mental health, we should be able to talk about mental health not always from a debilitating clinical syndrome perspective. Sometimes mental health is, my sister and I have always gotten along. Now that we are 25, our relationship seems to have hit a gulf. That's something that can impact someone's mental health. Is that diagnosable? You know, you need all the details in the equation to know if it's diagnosable or not. But I think the point that I'm trying to underscore here is most of us go to the doctor. We go for annual physicals and stuff like that. But most people have never gone for a mental health checkup.
Yeah. This is true, and it's kind of something that, you know, we don't even talk about a whole lot, because I even realized by me being in this field, probably the last few years, probably the last 2 or 3 years, I've kind of realized, like, once I go home, I don't talk about, one, because of confidentiality, but, I don't talk about anything about what I do, and things like that. And even, if I go, to family reunions or things like that, I may say where I work and it ends there. But as of anything else, and I think too, even though people may know where I work, it's still one of those things that they don't ask for anything, because I don't know. I think people think that we're always analyzing, in which that's not my personality at all, But I think on a personal basis, a lot of times people just don't talk about it. And I'm at this point now, it's like, yeah, we need to talk about it more. We need to really check in with people, because you just never know what's going on with someone.
Absolutely. I mean, that's so true. I mean, so often people are in denial, you know, and with boys turning into young men and then turning into men, I can tell you right now that is something that men in general struggle with, you know.
Hmm.
Again, because you can't show weakness. You can't show weakness. So if there is a problem, if there is a mental health problem, you're experiencing symptoms maybe you're not familiar with, or you know a little bit of your family history, and you're saying, well, no, that can't be me. That's not going to be me. Sometimes people just deny, deny, deny. They don't really want to know about what some of the problems might be, because then I have to do something about it.
Yeah. And one thing I try to explain to people is kind of like it's on a continuum. It's like we all experience some level of sadness and even some level of depression. It's just a matter of where is it on that, continuum. And even when it comes to anxiety, I would say those two are probably the most common ones that people experience at some point in their lives. And, like you said, we can be in denial, but hey, we need to talk about it, or at least, talk to somebody, go somewhere, do something, because by not talking about it, it can fester up and really make something worse. If you're not talking, even if it's not a professional, to be able to release those emotions to someone. And like I practice, yoga and meditation, and I've been exposed to Reiki and things like that. And honestly, what I have found as a, mental health clinician, because I've worked in a lot of different places where medication and therapy is very helpful for a lot of people, but there are some people that it's not helpful for, and we're not. And when I say that, I'm not talking about certain type of people. It's not even about the severity of a mental illness of itself. It's more of that emotional pain, because those emotions get stuck in our body. Because even when I was going through a storm myself, all the talking wasn't going to do me any good, because I was in so much pain. And the thing that helped me the most, was meditation. Helped me probably more, because I did that more so than I did anything else. And that was the thing that helped calm my mind down and relax my muscles. Because again, yeah, I can talk until I'm blue in the face, but it just wasn't going to help me. However, for other people, at least to be able to talk and identify something is going on with me, what is going on. And I think that's just so important for people to be able to hear other people, say, I have something going on, with me. I'm not okay. Because the other thing is, when people perceive you as being a strong person, they just think that thing is always okay, even when you're going through something.
And I love the fact that you made that point, that's what's worked. That is what worked for you, because the reality
Hmm.
of it is, I like to look at it like tools in the tool chest. Not
Exactly.
not every tool are you going to always use. Not every
Hmm.
tool is always best, but it's there and it's available. So
Hmm.
yoga is a tool in your tool chest.
Exactly.
Medication, psychotropic medication is a tool in someone else's tool chest. Talk therapy is a tool. Now, these are tools that can be in all of our tool chests at different seasons in our life. We may respond better to one or another. It just really depends. So I like the way that you said, hey, talk therapy, after a while, that didn't do so much for me. I needed something else. And there are a lot of different alternatives that people can, open themselves up to that, may be effective. Once again, we're talking about tools in the tool chest.
Yes, exactly. This is so true. Now, when it comes to men, because we talked a little bit about, boys, the messages that, boys get when they're younger anyway of not expressing their emotions. And then, of course, growing up, how it looks upon a certain way. What do you think, that is a society can do to help men, I guess, be there for men, open up there, because the thing that I see that's happening, well, one, I see two things. One thing that I do see, which is very good, is that there are a lot of men that say, hey, we got to stop this. We need to open up. We need to talk. So, there's a lot of men platforms that are out there. But like for the men who have not gotten there yet, what can we tell them to say, hey, you're not the only one who's going through something. This is, it's normal to feel this way. Open up to somebody, or at least I always say, I tell people now, read, look at listen to podcasts, watch YouTube videos, talk to friends, even be in the company, because you'll be so surprised at what you'll pick up. Because I learned a lot about myself just by listening to a lot of. But anyway, what can you tell men? What would be your suggestions for men?
Well, it's kind of a trick question because you're asking about men, but the question is, how can we change the narrative with men? And really, it won't start with men. It actually starts with boys. Actually, I had a chance to speak to about 20 to 25 boys this week, and the conversation centered around tools to manhood. And so we went through what we thought a man is, what a man looks like, what are the responsibilities of manhood. And then the question was, well, when does a man learn how to be a man? And it's in boyhood. So we have a lot of men. Yeah, we have a lot of men who are struggling or not doing so well, and include me in the pack. I'm a guy's guy. Like I learned all of that stuff. Don't show weakness. So I don't want to. I'm not excluding myself from that. Most of the guys I know learned unhealthy patterns and unhealthy habits. I'm fortunate to be in the field, so I know the benefit of making a change. Just because it's what we've always done doesn't mean it was best, doesn't mean it was right. So
that's true.
It really takes men, I think, putting down that pride, that ego, putting down that bullishness, if you will, and begin to open themselves up. Figure out what will work best for them. A men's group may not be best for them. Individual therapy may not be the best place to start. The best place for some men may be a book where they can read, a series of books or listen to a series of books at their own pace, at their own time. That may begin to change the narrative for them. Whereas some people, you immerse them in individual therapy, press the pedal to the gas and don't look back. That may work best for that guy. So again, it's about tools in the tool chest. Not everything is going to work for everyone.
Yeah, this is true. That is so true.
It's and to your point about what can you tell men?
Mm-hmm.
There's not a single thing that we can mention, and we probably could mention 100 different things
Mm-hmm.
that we could bring up, that there's not someone who would have had struggled with it at some point, or is
Mm-hmm.
currently struggling with it. But
Mm-hmm.
that's part of the pull with mental health, is that most battles are won or lost in our mind. And so people get these thoughts in the field, in the mental health field, we call them cognitive distortions.
Mm-hmm.
And that's something that you tell yourself, you take a piece of information that most likely is not true, and you just recklessly apply it to a situation. So, you tell yourself certain things and you ruminate on that. And then the thing of it is, those thoughts becomes feelings, and then we know the
Mm-hmm.
story. Those feelings become behavior. And then,
Yeah.
and oftentimes it's all not necessarily a misunderstanding, because how you feel is very real. But if you're making decisions on false information or inaccurate information, is that best?
Yeah. And it's pretty much, I always used to tell people, it's pretty much just like our perception. Life is about perceptions. It's not always about what really happened, it's how we perceive it to happen. And one thing I want to add is, like, when it comes to sitting still, sitting in silence, it helps with that. It helps us to kind of identify, like watching our thoughts, observing our thoughts. Is like, oh, was that me? Why am I reacting this way? And they kind of sort all of that stuff out. And that's one of the reasons, like, I started Black Men meditation series. And pretty much the first part of it is for Black men who are meditation instructors, for them to talk about, meditation and what it is. And then eventually I'll start talking to Black men who meditate. And then I'll add on of having meditation sessions with Black men as well, so that they can hear it from other, Black men, and not just think, oh, it's just something out there. Where there are a lot of Black men out there who have said, this has really changed, my life. Because one of the things that I want to do is, again, introduce tools, like even way before therapy is needed. Because what I discovered, even for myself, and what I've seen too in working in mental health, is that a lot of stuff fester on for extremely long time before someone set foot into, a therapy, into therapy, or if they have to go inpatient to a hospital or anything like that. And so if we can, if people can start using tools early on, then that is even better.
Absolutely. And one thing that you said that I wanted to underscore, that if men can hear other men talk about it, that there's something that can be freeing about that. And that, I believe, is true,
Mm-hmm.
in the sense that it's a tool in the tool chest. But
Mm-hmm.
also, I think people overestimate the fact that a man will want to have a conversation with another man, or, oh, they would like a male therapist. Every man is not to that point. Again,
Yeah,
it'll work great for some men. It'll work
Mm-hmm.
great for some men. And for other
Mm-hmm.
men, they're so enmeshed, they're so stuck in their way, they couldn't dare open up to a man.
Yeah.
Yeah, so it's
Yeah.
again, it's it's different for everyone.
Oh yeah, exactly. It's kind of one of those things, have a little bit of everything, because I do, because I know even when I first started doing some of this, someone was telling me, like a guy was telling me, like one of their guy friends was like, oh, well, why is she doing that? A man should be doing that. And it's kind of like, hey, the way I look at it is, as many people, we need as many people to support men. So whether it's a female or a man doing it, we just need as many people, because the way, one reason that I decided to do it was because, I saw a need, if you say personally, and I saw a need professionally as well, because when it comes to programming, whether it's community resources and things like that, and also in the yoga community, there's just not enough stuff out there for Black men. So a lot of Black men are doing some wonderful things out there, but compared, I mean, every time you look around, there's a retreat for women, there's a women conference, and for men, it's just, the numbers are not high of the resources that's out there. And so, so it's kind of like for those who gravitate towards it, that's good. And if not, hey, because part of what I do too is I'm connecting people, with other Black men out there. And that's one of the reasons that I'm doing this as well. Because you were mentioning, like reading and things like that, or listening to something. Like, for instance, the barbershop group, I follow them, and they have, gosh, a wonderful Black platform. And then I mentioned Reginald Howard, he has the Black Mental Health Podcast. Oh, yeah, you know him. And he wrote a book as well. And so, and then we have two Mikes, Mike from Changing the Narrative and Mike from the Man Initiative. They have, platforms out there. And so, hey, if men want to go out there, I mean, there are more, but those are the ones, I'm just pointing out right now. But there's just so many different things that men have access to, but it's still not enough, It's still not enough, but it's it's a beginning point.
Absolutely.
Yeah. And so with you, just in general, what are some of the resources out there for individuals for the mental wellness?
Well, you have in most areas there are groups. It depends on if a group is something you want to give a shot or not. A lot of times men find themselves in groups when it's court mandated. It may be anger management. It may be an anger management group or a substance abuse group or something of that nature. But there are groups available. There's individual services available. And a lot of times when we talk about barriers to wellness in the African American community, I think a lot of times people think they're not aware that it's not going to cost them, particularly if they're in a low income situation. Oftentimes they have the insurance, and therapy can be a part of it, but they may not be aware of that. So a lot of times it's just a matter of education. So individual therapy is available, and that's just one-on-one, the therapist and the person. And in addition to that, if the symptoms are such to the degree that the person might need some medication, and I'm not promoting medication, but I understand that it helps some people. It knocks the edge off just enough where it helps some people. And I respect the point of view that, medication, our people shouldn't be taking medication. That's held in high esteem by some, that those medications aren't for African Americans. We shouldn't be taking psychotropic medication. And I can understand someone holding fast to that, because historically, our young people have been misdiagnosed and have been given medication that has led to other addictions later. But the reality of the matter is medication does help some people. So again, I like to keep it as a tool in the tool chest as opposed to just completely eliminating it. So you have medication is an option, individual therapy, group therapy, family therapy. All of these are resources. And, friendship, that is valuable. Books, we mentioned audio books and other books. Those things are valuable. So, I mean, there are a lot of tools. It's just a matter of will men begin to take advantage of those tools.
Yeah, this is so true, so true. And it's kind of one of those things in too that, like sometimes some people can have something going on and they may not even realize that they have something going on, because I even look at myself in the sense that I tell people there was a period of time in my life where I lost myself. And people are like, what do you mean, Sharon? And I was talking to one of my friends and I was like, yeah, I lost myself and nobody around me knew I lost myself, because you can get up and go to work and do your everyday thing, but that sense of who you are as a person, and I couldn't even tell you what happened. I mean, I have no idea. When I look back on it, I say, oh, it may be this and that, the other. It could have been stress. I have no idea. But the thing of how I realized that I lost myself, I was talking to a friend, and the friend happened to say something, and whatever I can't even remember what the friend said, but whatever the friend said, it reminded me of myself or how I used to be. And I'm like, wait a minute, I used to say things like that. Wait a minute, what happened to me? I lost myself. And then it really wasn't until probably another 6 months, it's almost like as I was regaining myself that I really truly realized, wow, I really did lose myself, because at that time I was working nights. I mean, it could have been, I can't even tell you, what happened. I was going through a storm too, but I lost myself before I went through the storm. You know what I mean? And so, I have no idea. And that shows you, too, of how subtle it can be, because meaning that people can be around you and don't even know it. I wasn't feeding. Go ahead.
No, I'm sorry. I was just going to say, and it's equally as easy for men to lose themselves, especially when you hear things like a man's got to do what a man's got to do.
Mm-hmm.
Keep it moving. Push through, get over it, suck it up. These are all things that typically boys hear from early on. So that becomes part of the narrative. You don't really stop to feel. You just tough it out, if you will. You just tough it out and keep it moving. And so it's easy. It's easy, and then when you get into adulthood and further, your obligation is to, if you're a parent, to be a provider. If you're married, you gotta, be a provider. You should be in your rightful place. So it doesn't really lend itself to moments of weakness or anything like that. So that's probably why a lot of men find themselves in a compromised state, because they've had to suck it up when Uncle Jim died. They had to suck it up when they lost their brother. They had to suck it up when they were wrongfully terminated from a job. They had to suck it up with everything that they've seen in the community, and a lot of times it comes out in the wrong way.
Yeah, exactly. And then when it comes to those things too, what you just named, what people don't realize is that, like, sometimes someone can be, agitated or irritable or something like that. And sometimes you may not realize that could be, some of the symptoms. You think, oh, they're just in a bad mood. But then over time, that bad mood kind of goes back to what you were just talking about, of how eventually it can explode. But yeah, one of the reasons I wanted to share like that piece about me is just to let people know, it's like when you see changes in people, like, don't take it personal. It has nothing to do with you, and to bring it up with the person, because you can just say, you just notice something different about them. That'd be if you notice. Because unfortunately with our society, we're so busy doing and not, being, because you were talking about, God doing this. That's like, gosh, that's doing, that's what our society is all about. Because even for us females, do this, do that, of being a woman and all of that. And then you can easily, just get taken away without being who you are, as a person. And so, again, it's almost like the more I talk about this, it just kind of goes back to, just centering ourselves, just being still. And, like that part was taken away from us, as a culture as well. I mean, there's a lot of things that we don't know about our culture, and I'm catching up. I never used to be a history buff or anything, but I'm one now. I'm learning all that I can, and that is important. But I know, when it comes to people, everybody, pretty much have to look at that, in their own time. But it really does go into who we are as a person, as people, and it has a lot, I know I tell people, yeah, they talk about these generational traumas. I say, yeah, but remember, we have generational treasures too. And so there's a lot of gifts and things that we have within us, and a lot of skills and abilities that we have, and a lot of, knowledge and wisdom. But with all of us, kind of busy trying to provide, and especially with men being providers and protectors, that's a lot of stuff that's on you guys.
Absolutely, for sure.
Yeah. Well, is there anything else that you would like to share? Any last words before we end?
No. This is a continuum. We got to continue to have a bunch of conversations like this. There's a lot of good people doing a lot of good work trying to change things, because I believe, obviously, as a mental health advocate, as a mental health professional, that at the crux of a lot of the societal ills that we see are mental health problems. So it's a lot of good people doing a lot of good work. So we got to continue to do our part.
Yeah, it's all about us just healing. My take on it is that, as we heal ourselves, individually, then we can heal, collectively, in groups, in community, and with the world. But we got to do our own, individual stuff. And as they say, it's an inside job for all of us. And one thing I want people to know, men and women, is that, when it comes to that, none of us are exempt, when it comes to, being mentally well. It's like we all put what we need into it, but none of us are exempt. It doesn't matter who you are, it will hit us at some point.
It's a domain. It's just like our physical health is a domain, our spiritual health is a domain, our mental health is a domain, and we have to pay attention to it.
This is true. Well, I really do appreciate you sharing your knowledge and wisdom.
More than welcome. Thanks for having me.
All right. Well, everybody, you have a good evening out there, and thanks for those who joined us.
All right. Take care.
All right. You too.
All right. See you.